Hi, I'm Dr. C. Suman Kumar, consultant pediatrician, Ankura Hospital. Nowadays, children, thanks to the lifestyle, thanks to the eating habits, thanks to the sleeping habits and mobility in a child, children are suffering from indigestion, constipation, and irritable bowel symptoms like intermittent stomach pain and too many frequency of stools also. Why is this happening nowadays? It's because of the kind of diet the children are being fed. Right from 6 months onwards, the children are being fed with biscuits, junk, bread, chocos, and stuff like that. So, what happens? Too many sweets and carbonated drinks. What happens? The intestinal layer gets damaged, and the content which is present in these junk food causes a lot of indigestion problems because the enzymes are not completely developed. The intestine maturity doesn't happen well. These children tend to have too much of indigestion problems and constipation problems. Not only that, the lifestyle also, the children have become more and more sedentary because they are sticking on to this lot of gadgets in front of them, and the moment we ask them what games do they play, the only games they say is about mobile games rather than playing outside. The more mobile the children are, the more active the children are, the more water they take, the more fruits they eat, the more they chew, and more healthier they eat, lesser the constipation, lesser the indigestion problem, lesser the irritability in the bowel are concerned will be there in these children. So most of these problems are because of these conditions. So first 2 years, if the child is fed with too much of junk food, too much of sugar, too much of milk, the child is bound to be constipated, bound to have indigestion problems, bound to have irritable bowel syndromes. So less of these, the children will be doing good. So my advice is to avoid junk food for at least for the first 2 years of life, and indicate at least 2 to 3 times, give him a good fruit diet and encourage the child to chew well, and never allow the child to eat food in front of a mobile or a screen. Let the child focus on food when they are eating, and let them encourage to chew well before they are eating, and it should be house made, houseful diet. Doesn't matter, whatever is prepared in the house, home food should be preferred to the child, and it should not be outside food. Doesn't matter even if the child is little bit on the lower side as far as the weight is concerned, as far as mental development is good, his height is good, he doesn't have any deficiency, iron deficiency, mineral deficiency, or vitamin deficiency, let us not worry about the weight. Rest all will follow. That let us focus only on home based diet. Thank you.